I'm Megan Lucey, and this is my poster titled The Role of the Medical Surgical Nurse in the Treatment of Persons Living with Sickle Cell Anemia. So for some background on this poster and this topic, sickle cell anemia is a congenital hereditary disorder that affects the hemoglobin molecules in red blood cells. It causes them to get like a sickled shape, which you can see in this figure 2 on the bottom in the middle. On the left, you can see that's a sickled red blood cell compared to a normal red blood cell. So caring for patients with this disorder is complex due to factors that surround the disorder. The blood cells being this shape causes a lot of pain for the patients. It can cause them to have vaso-occlusive crises. And the treatment commonly for this disorder is opioids to help them manage that pain. So patients with this disease can be viewed as drug seeking because they need those opioids to treat their pain. And as shown in figure 1, the races of sickle cell anemia patients, 91% of people with this disorder are Black, 4% are Hispanic, 2% are white, and 3% are another race. This also makes the treatment of this disorder complex due to racial bias. And this racial bias can be compounded by the drug-seeking stigma associated with sickle cell anemia. Overall, an estimated 100,000 people in the United States have sickle cell anemia. So for this study, the methods I used were a literature review conducted on sickle cell anemia to identify the barriers of caring for a patient with sickle cell anemia and the best practices for treating them. And I used the scholarly databases, they're listed there for this literature review. The summary of my findings are that barriers that can interfere with the care of sickle cell anemia patients include patients being seen as drug seeking, again, due to opioids being their primary method of treatment for that pain, and the racial bias due to many of these patients being people of color. The best practices for treating sickle cell anemia include provision of additional education for nurses about sickle cell anemia and how to care for the patient population. So this would be teaching them about the disease, the pain that it causes, and teaching them about how you can effectively care for a patient with this disease. Utilization of complementary and alternative medicine therapies to treat sickle cell anemia pain. This can help with the opioids issue if you use things like heat and alternative medicine therapies to treat their pain. They're not going to be on opioids as much. They might still be on them a little bit, but that can help. And implementation of a screening and care referral process for patients with SCA. So this would just help you kind of screen them, see that they have it, see their issues with it. And utilization of opioids such as morphine and IV fluids for pain. Again, with SCA, one of the symptoms they can experience is a lot of dehydration, which is why IV fluids can help. And again, the pain that it causes, opioids and morphine can help with that. So implications for practice. By implementing the above recommendations, nurses can provide higher quality care for sickle cell anemia patients. And this is important because of the bias they experience. They need their concerns addressed, their pain fixed and evaluated. And that's it.